people will be paying, in some cases, more in taxes, but overall, because they're not going to pay premiums, deductibles, co-payments, they'll be paying less for their health care.
People don't want government or anyone to take away their choices. My Medicare for All plan will allow private insurers to be a part of our plan if they play by the rules.
So this can be a big issue. Kamala Harris splitting with Bernie Sanders on Medicare for All, despite co-sponsoring the plan, along with several other Democratic hopefuls. Centers for Medicare and Medicaid Services, the administrator is Seema Verman. Welcome to our program and good morning to you. I know you can't comment a lot on the candidates, but let's keep away from candidates, stay on the issue. Medicare for All, is that a reality for America in 2020?
Well, I think the discussion is about the future of the American healthcare system and who do we want making decisions about our healthcare? Do we want Washington making decisions about our healthcare, or do we want Americans and American patients making decisions that are going to work best for them? Okay, so here is Sanders and Kamala Harris side by they're just generically, okay. Premiums on household incomes, he's at $29,000, she's at $100,000. Transition period, he's at 4 years, she's at 10 years, according to her plan released yesterday. Private insurance, Medicare Advantage, and Medicare certified sources. That's what you get there. And I can't comment on candidates, but these two senators are going to get a lot of attention for the issue. And you wonder if health care is the one issue that defines the primary season for the left. Well, I think what we're seeing is just versions of government-run healthcare, whether it's public option or Medicare for All. It's all about the government being in control and making decisions about our healthcare, and Washington making decisions. What the president is trying to focus on is a vision that puts Americans in control, making choices about their healthcare. Just yesterday, we released a proposal about price transparency, and this was built off the president's executive order that he did last month. And what CMS proposed in reaction to his executive order was essentially a proposal that would require hospitals to post cost information so that patients on the front end can get information, they can understand what they're going to pay before they get hit with a bill on the back end. So these are historic changes.
So you would allow people to shop for health care to get a better deal.
That's exactly it. You know, there's so much variation in hospital charges. I was just reading this morning that for a lower back MRI, you can get that service in Louisiana for $141. But in California, that same service cost $47,000. And so there's so much variation. We want to put patients in charge, making decisions and giving them the information that they need to figure out what's going to work best for them. And we know the American consumer can shop around.
How does that help the consumer? How does that make their life better?
Well, I think it gives them the ability to shop around for services and lets them shop around for the best deal. There is so much variation, and they don't have this information. I mean, if you think about it, in every other sector of the economy, you know prices before you're going to buy them. You're buying a car, you're getting an airline ticket. You have that information on the front end. And what President Trump is trying to do is tackle some of America's most pressing healthcare challenges. And price transparency has been out there for a long time, and American patients have been in the dark. And we're trying to turn the page on that, make sure that they have that information on the front end.
Seema Verma, thank you for your time. It's just a proposal. We'll see how far you get with it. Thank you for your time today from CMS.
My pleasure. Thank you.